Hey YouTube friends, do you have a knee cartilage problem and you're unsure of what works and what doesn't? Well, that's exactly what I'm going to talk about in today's video. My name is Dr. Dave Midoff and I'm a specialist physical therapist over at Paso Manual Physical Therapy. And I've been helping people out with knee problems for years and have a pretty good understanding of things that work and things that absolutely don't work for knee problems. So if you're looking for exactly what to do and what to avoid, here's the video for you if you're suffering from a knee cartilage problem. Let's start with the first one. Here's something that works: using a stationary bike. Time and time again, I recommend this to patients. The reason why is because for knee cartilage problems specifically, having that repetitive motion that a stationary bike puts you through is very beneficial to move around the fluid within the knee joint. There's something called synovial fluid, the juice, the joint juice that's inside of a knee. It needs to circulate, and when you gently bend and straighten out your knee joint, it allows the fluid in there to move around. It's important to get the fluid to move around because it's what nourishes the cartilage inside the knee joint. It's pretty well known that cartilage does not have a good blood supply. Otherwise, it would heal faster and you wouldn't have as much problems with knee cartilage, but it just doesn't have a good blood supply. So the fluid from the knee joint is what helps to nourish the tissue better, the cartilage tissue. So using a bike is great. The other added benefit of using the bike is that it doesn't put a whole lot of stress through the knee joints. Is as long as you're not super stiff and can't bend your knee all the way when you're going through the bike, or it's not extremely irritated and just hurts no matter what you're going to do, using a stationary bike is pretty good. A side note of this is I often get asked, well, I don't have a stationary bike, but I have a bike you can take out on the streets. Is that okay? Proceed with caution on this one. If you feel confident that your knee isn't going to get worse if you take a spill, or that you're going to have to climb hills depending on where you're going to go ride your bike, have to push the pedals really hard to go uphill, and that you're safe to stop and put your feet down real quick without hurting your knee, then proceed. But if you're concerned about any of those situations on a bike, I might look at getting a stationary bike or going to a gym that has a stationary bike. And there's also the option of buying devices, they're called bike trainers, in order to turn your outdoors bike into a stationary bike that you can use within the home. So those are all good options to help your knee cartilage. Now, what doesn't work, that would be something that people think of alternatively to the stationary bike, is using a treadmill. Occasionally, some people can get away with using the treadmill and not making their knee cartilage problem worse, but oftentimes the way that people walk is one of the problems that has led to them getting their knee cartilage injured to begin with. So walking is just not a good idea, and that goes for outdoor walking too. Oftentimes you get people that come in here with knee problems, especially knee cartilage problems, and they say, well, walking's good, isn't it? I mean, we all need to be walking, so I'm going to go out to the park and walk, or I'm going to walk around the block, or we've been in quarantine time right now, so even just walking around the yard in the house, that's a good thing for my knee health, right? Well, no, not if you have a big muscle imbalance that's going to force you to put excessive pressures through your cartilage. That's likely what got you the knee cartilage problem to begin with. So we want to avoid using a treadmill or going on walks if you've got a knee cartilage problem, because chances are you're just going to wear it down worse over time. And it's sneaky. Sometimes it doesn't hurt a whole lot if you walk lightly, or if you set the treadmill to an incline. It actually will make it just a bit easier for you to tolerate walking, but it's still not a good thing because it's forcing you to use the wrong muscles. Those muscle imbalances have to be corrected in order for that knee cartilage problem to go away for the long term. But that's another video. You can check out our other videos to see that on our YouTube channel or on our blog as well. Here's the next thing that works: strengthening your butt muscles. Oftentimes, this is challenging for people to do on their own at home. They just can't quite get the right exercise or can't do it in a way that doesn't aggravate the knee. Once it's figured out, once we can get the butt muscles tired consistently in an exercise, that is huge. That is gold for knee problems. Strengthening butt muscles is almost always going to be an excellent thing to do if somebody is suffering from a knee cartilage issue. Now, what doesn't work is strengthening the quad muscles. One of the common exercises that people go do whenever they've got a knee cartilage problem is knee extension exercises. So the most common way people do this, because there's all kinds of ways, is they'll go to the gym and they'll get on the machine where you sit down, and it's got usually a cylinder shaped pad that you tuck your feet behind, and then it's got the stack of weights, and you choose your weight, you put the pin in the weights, and then you straighten out your knees and bend them, and every time you straighten out your knees, you're pushing against the resistance and lifting up the weights. That is probably the worst exercise that you can do for a knee cartilage problem. And the thing is, it's deceiving, because at first glance it kind of makes sense to strengthen the quad muscles if you've got a knee cartilage problem, because it's the muscles that are closest to the knee problem. And it might actually kind of feel good after a while to do the exercise, but that's just the body's way of forcing yourself to get through it. At the end of the day, if you've got quad muscles, the muscles in the front of the thigh above the knee joint, that are too strong, it's going to end up putting extra pressure through the knee joint, and that is not a good thing for the long term. You're gonna make that knee cartilage problem worse. You're just on the expressway to having some more damaging knee problem happen down the line. You're gonna need a surgery of some sort. You're gonna further damage the cartilage. So you wanna stop doing any sort of isolated knee extension exercises. That doesn't work. Something else that does work is stretching your quads and your hamstrings. Now, there's different ways to do this, and it's got to be gentle. The proper way to stretch quads and hamstrings, because it's often done incorrectly, is to stay low intensity with the stretch. If I gave you a scale 0 to 10, 0 meaning nothing at all, you feel zero stretch at all, and 10 meaning you're about to tear something because you're stretching so hard, you really want to stay on the lower end of the scale. You want to stay like at a 2 or 3 stretching intensity. You don't want to stretch really, really intense. That low level stretch is really what allows those muscles to relax and calm down, so that it's putting less pressure through the knee joints and saving your knee cartilage rather than further injuring it. Now, what doesn't work is stretching the glute muscles, which I often hear patients doing. They'll do like a figure 4 type stretch where they'll cross their knee over their other leg, they'll cross their ankle over their other knee and then pull their legs towards them, and it stretches the butt area. You generally don't want to stretch muscles that need to get stronger. As I've said already, you need to get stronger butt muscles. That's going to help out a knee problem. That works. So if you're stretching a muscle that should technically be getting stronger, it's kind of working against itself in that aspect. So stretching out the butt muscles, although it might feel good, it might feel relieving to stretch, and just some people really like the sensation of a stretch, it's not a good thing to be doing in the long term, especially if it's the thing that you go to the most. You want to stop stretching your glutes, start strengthening them, stop stretching your quads, start stretching those for sure. Here's the last 2 things that work and don't work. What works for sure is gradual exercise for your knee. You want to keep moving. You want to make sure that you're doing something that helps out your knee problem, something active that helps out your knee problem. It doesn't have to be the most active ever. It doesn't have to be intense. You don't have to sweat. You don't have to grit through pain. In fact, what doesn't work is completely resting it, like staying off of it completely and reducing your exercise activity to nothing. Or the other extreme that doesn't work is pushing through pain and walking faster, harder, or running. It's only going to get worse over time. You don't want to push through pain with cartilage problems. And with cartilage problems, the pain might be sneaky sometimes. It might not hurt then and there when you're doing the exercise, or even immediately afterwards. It might happen later on in the day, like the evening after you work out, or even the next day or at night it might wake you up. If that's what you're experiencing, then you need to adjust your exercise so that it's something that feels good while you're doing it and allows you to feel good afterwards, and even in the next days afterwards. You should be able to find some exercises that just don't aggravate it at all. It's rare, it does happen, but it's rare that the no pain, no gain situation applies to rehabilitating, to fixing a knee cartilage problem. Usually it should feel like you got warmed up, maybe started to sweat if you're feeling better and can tolerate it. But generally your knees should feel better and better and better as you go along through the right exercise series so that you can heal a knee cartilage problem. Just a quick side note here, let's talk supplements. I'm not going to say this works or doesn't work, by the way, but I know you might be thinking about that already because you're taking a supplement. The two most common ones are glucosamine and chondroitin. They're joint supplements. And there's tons of research on this stuff, and there's tons of confusion about it as well. We don't have very clear understandings on the research. There's research articles out there that show that it does help, taking glucosamine and chondroitin with knee problems. And then there's other research that shows that it doesn't help. What we know is that it's generally safe. As long as you don't have any sort of reaction, any allergy to it the first time you take it, or anytime throughout, you should be safe to take it. Now, some people report they feel better. Cool. If that's you, then great. You shouldn't have a problem continuing to take glucosamine and chondroitin. Now, if you're the type, though, that you took it and you didn't feel any difference, it's up to you if you want to continue. Like I said, it's not really going to hurt you, but you have to question if it's really helping you at all and if it's something that you want to continue doing for the long term to help out your knee cartilage problem. So that one's a toss-up. I can't tell you that it works for sure, that it doesn't. What I hope to do today for you is just tell you the truth about it so that you can make the best decision for yourself. So there you go, my friends. There's a quick list on what works and what doesn't work when it comes to knee cartilage health. I hope that this video was helpful for you today. If you liked it and you thought that it was good, please hit the like button right here and hit the subscribe button right over there so that you can get notified of whenever we release helpful new videos for you. Thanks so much and have a wonderful day. Bye-bye.